Hello. Thank you for your interest in our therapeutic music program. My name is Ruth Kleinpel, and I'm faculty at Vanderbilt University School of Nursing. My role there is the Assistant Dean of Clinical Scholarship. I'm also a nurse practitioner, and I have clinical experience in the surgical ICU.
I'm Dr. Joseph Schlesinger. I'm an anesthesiologist and an ICU doctor. Previous to medical school, my background is in music. I'm a jazz pianist. That's why Dr. Kleinpel and I are well suited to work together on this project.
So Joe, we're excited to be able to report that we have prepared and launched the Therapeutic Music in the ICU initiative. Could you speak a little bit about the work we've been doing?
Absolutely. We've been working on this for over a year to get it off the ground. Through this, we now have over 10 music volunteers comprising pianists, violinists, cellists, and flutists.
Well, being ICU clinicians, we know the environment in the intensive care unit can be quite stressful, not only for patients and families, but also for the staff. So as part of Joe and I's project work, we have thoroughly reviewed different programs in the literature as well as initiatives that have been implemented. And Joe, can you speak to the reason that therapeutic music in the ICU using classical music is best for patients in the ICU?
Well, as you said, through studies that have been done, especially in the UK and Ireland and Australia, there's been a lot of literature that shows the benefit of the classical music repertoire. And we've seen that as we've started our own pilot program before we've done other data collection, seeing the patients, their affect softens, the staff gather and feel better, less stress, less burnt out. Seeing tearful reactions, patients who have a past history in music themselves, even patients trying to conduct as the musicians play.
Tell us a bit more about the local artist that was able to donate their time and paint the piano.
There's a local Nashville artist, Aaron Graham, who was very generous with his time and painted the piano donated by Nashville Piano Rescue. When you think of pianos being painted, it's kind of a crazy thought, but you think of the time and effort he spent to really think how can we make the piano creative and change the environment of the ICU. And so he's donated his time, painted the piano, and it was debuted at Studio 208 downtown during Nashville's Art Crawl.
And we're thrilled to have collaborative partners. Can you speak a bit to that?
At Vanderbilt, we really don't do research in a silo. We've broken down those barriers, and we have a multidisciplinary team of the School of Nursing, the School of Medicine, the Music Mind and Society Research Group in the Department of Otolaryngology, and the Blair School of Music.
Well, and as we were planning the program, we looked at a number of studies that had used music in the intensive care unit, and several of those had used recorded music or headsets for patients to hear music. And if you can speak a bit to why live music is really optimal.
While recorded music is certainly easy, and you could say, well, having music versus no music might be an advantage, think of why do you even go to a concert? It's that multi-sensory experience. You feel that vibration of the music. You see the musician in front of you performing their art and their passion, and you connect with them. And it's that human connection that really is going to help in critical care medicine.
And we identified the environment here at Vanderbilt University Medical Center as really an ideal place to launch this with respect to the music of this area.
Vanderbilt being a huge academic medical center, large catchment area, level 1 trauma center, multiple ICU staffed by surgery, medicine, and anesthesiology. In Nashville, Music City, where we have great musicians, so there's no better place to have the confluence of music and medicine.